Cervical cancer is one of the most common gynecological cancers that occurs in women. It is characterized by the abnormal growth of cells in the cervix, mostly at the region of the uterus that joins the vagina, caused by the human papilloma virus. In Zambia, cervical cancer has become a growing concern with an estimated 65.5 cases per 100,000 women and 43.4 deaths per 100,000 women recorded, making the country the third highest per cervical cancer cases globally according to the World Health Organization 2021 report. Health experts around the world have established that if it is detected at a precancerous stage, it can be treated or prevented.
So if you look at cancers, and particularly cancers affecting our women, you will see that cervical cancer becomes a prominent cancer affecting our women of reproductive age. And as a province, indeed, what we did, we are coming from an area where we only had one clinic that was able to screen our women. Because as a ministry, we are following a strategy which we are calling 90-70-90. Meaning that the first step to prevent cervical cancer is actually vaccination.
The Ministry of Health is making significant strides towards creating awareness on the importance of screening against the disease. In Chinsali district of Muchinga province, the ministry has set some targets for screening women and vaccination campaigns against the deadly disease.
We want to ensure that 90% of our girls actually are vaccinated, and the age group basically is what we've itemized. But if you look at our coverage as a province, in the last campaign we didn't reach 90%, but we are trying to ensure that in the next campaign, child health campaign, we are going to reach 90% of our young girls getting vaccinated, and these are girls below 15, 13, 9, like that. And then the next aspect of cervical cancer strategic goal is to ensure that 70% women are screened. In the province, screening we are doing very well because all the 9 districts in the province have a cervical cancer screening clinic. So we have been able to screen a lot of women. And the other part has been treatment, which is 90% of our women after being screened should be treated in what we are calling a comprehensive approach, so a single visit approach. So what we've done is that even that initially we only had about 2 clinics that were treating women that were not eligible for cryo and that what we've done now, these women that were eligible for LEAP, there's a procedure which we need to treat them if we can't treat them with cryotherapy. So we initially only had 2 clinics that were doing that, but all the 8 clinics in all the 8 districts have got these clinics. So in the 90-70 strategy, as a province, we've managed to ensure that we are at 100%. All the districts in the province are able to screen and treat our women for cervical cancer.
Bwalia Mlenga is a registered nurse operating from the cervical cancer clinic at Chinsali District Hospital and explains the process of screening.
Cervical cancer is basically caused by the virus called HPV, which is human papilloma virus. We've got different types of human papilloma viruses, but the ones that cause cervical cancer include 16 and 18. So basically that. Then the other types of cancers, we've also got 45, we've got 18, we've got these others that cause warts. Yes, so for cervical cancer, when a client comes to cervical cancer, I'm going to explain on the instruments that we use. So as at now, we have 2 methods that we're using for screening for cervical cancer. The first one, we're using the normal one where we use the speculum. Then the other one, we're using the HPV, like where we're looking for the actual virus that causes cervical cancer, which is the HPV. So with the HPV being the main causative virus for cervical cancer, we also have other predisposing factors such as age. Looking at age, somebody, the immunity might go low. That can also lead to somebody being predisposed to cervical cancer. We also have these other, let's say, if like it's hereditary, it can be in the in the family, if my mother had cervical cancer, chances of me also having cervical cancer are also high. Yes. So this is basically it. So for the normal one, when a client comes, we do give health education. After we give health education, then we do the screening. So this is the bed that we need. We have the bed here and the things that we're using for screening for cervical cancer. So the speculum we just use when the client is lying on the bed, then we just use it for opening, since like on the private part it's not open. Once we get the speculum, we insert it and then we open it, and then that's when we have access to the cervix. Then after we insert the speculum, we have these cotton swabs in vinegar. The vinegar is just the one that we use in our kitchen. That's the one that we use. So once we soak these the cotton swabs in vinegar, and then we get the sponge holding forceps. We get the cotton swab which is soaked in vinegar. Then we put it on the cervix. Then after 3 minutes, we use the camera. Then we'll capture. We'll see how the cervix is. If it has got lesions, we'll be able to tell, okay, the lesions are there. If the lesions are less than 75%, we'll do treat them using the cryo. If the lesions are more than 75%, we refer to a doctor where they do lip.
With some myths and misconceptions about cervical cancer screening, Sister Mlenga also explains further that the screening is conducted professionally.
They're slowly coming on board. We're screening some clients. Yes, I think with the more, we just have to do more of the sensitization, and most women fear the speculum. So you find that if for the speculum someone can come to the clinic, you tell them to screen, you tell them to go for screening for cervical cancer, unless if they have a problem or if they have any serious issue on the private part, but otherwise mostly they don't just come to the clinic to get screened. But with the HPV, they provide the brushes, since they know that there's no speculum that is involved. Yeah, the response has been good.
One of the women, Priscilla Sazombo, who regularly screens for cervical cancer, highlights her experience.
2018 nadishileko ya first. Nalemva ko problem kwa tifira mumala. So nako kudia banchita scan tamwali na ngufirimo fona ishile kuno. Na kwena kuno baisa chita bwino tamasangire na problem na imbi futi 2020 na isa ko na ina shakwete problem tapali chale kalpa na uchimo kali banje bala after 2 years and some months kuti mwabwela futi na ngwela. So na pana futi nimbwela but chikwete problem na ngwini nefa fe kuchecking.
Some of the women that have been screened have called upon their fellow women to undergo cervical cancer screening.
I would encourage them to go for cervical cancer screening, because once the disease is diagnosed early or detected early, it makes the health personnel to manage it. And they should not be even scared, because this time there is medication. Once it is detected early, it is managed. That's all I can say.
When I nalia koku screening, no kuya elo na ile ba ile sangu ko batishwete ubulweli. Then bale rando ko bati ufire basi ba pima kabiro ko bati bamonenga na kuchakuna ukwata kala kashisha akasenda ubulweli. Yakapera ubulweli. So chikankala kuli na mayo onse ukuya kuchipatala aishiba ubumi bwakwe ba ayapimwa ukuyishiba ifyali bantu bulweli obwikata kuchisa ubona ula ichisa cha muntu chakwana mayo. So chikankala na mayo onse ukuya kuchipatala.
Nellas Nanyangwe is a young mother with little knowledge about the disease.
Cervical cancer for isa atiri ngiri nairesa kupitira mufikofya kwa shitata ngatashitisha circumcised kuti wayambora shafine fikori namule kumana nankwe ati kuti leta ubulelele wa cervical cancer womwana kashikura kuchisa.
This disease does not only affect women. The male folk who are believed to be carriers of the disease have stressed the need for them to be circumcised to reduce the risk of cervical cancer and other infectious diseases.
Men have got a critical role in the spread of cervical cancer, especially men who are not circumcised. Actually, they have got the higher propensity in terms of spreading cancer. But those who may be circumcised, actually, the foreskin actually doesn't hide much of the viruses that would cause cervical cancer, because it actually improves the hygiene. Those who, as men, you find that men are different, the way in which they are made. Others, maybe they have got a very long foreskin, and the longer the foreskin, actually, the higher the propensity of hiding dirty. And now when you go to meet with the female partners, you actually, as you are enjoying your sexual intercourse, inwards, you could be actually donating some viruses, like maybe the human papilloma virus, that tend to cause cervical cancer. So I would encourage men also to actually consider male circumcision in order to reduce the risk for cervical cancer.
The Ministry of Health has further collaborated with various stakeholders in a bid to increase awareness on cervical cancer screening.
Sensitization. Indeed, that's truly a challenge we have, because we have not done so much. But with the partners that have come on board, like CHAI and Global Fund, we want to ensure that all our radio stations, all platforms of communication to our women on this important productive issue of cervical cancer screening is communicated. So if you look at our radio station within Chinsali here, we have come up with an agreement with our media to ensure that they start airing programs that would encourage our women. So yeah, we are encouraging all our women that are, eligible for screening to come forth and just get that screen. It might just be a life changer that would save their lives. But we've also wanted to incorporate our traditional leaders, our church leaders, religious leaders, in this whole approach of sensitizing women from cervical cancer. No woman should die from such a preventable cancer like cervical cancer, especially if they take that step to get screened first. We've had situations where our women, when they are screened, they've been screened late. In that regard, they have to be referred for specialized treatment to our cancer disease hospital in Lusaka, and the cost implications for such. So we are saying, before you reach a stage where these women come in late, we want to screen. And just now, like last month, we sent our team to the various health facilities. We are not just centralizing screening here at a hospital. This is hospital in Chinsali or general hospital. We are screening at the lowest level, such as a rural health center.
Some of the causes of cervical cancer also include the usage of a snuff kind of tobacco, locally known as insunko, which is used by some women to cure headaches and other illnesses. However, health practitioners have established that the substance has potential to trigger cervical cancer.
We don't encourage inserting anything unless if it's medically proven. So if it's not medically proven, we don't even encourage people to be inserting most of the stuff in their private part. Because you find that if, let's say, I insert the same bedroom suites or I insert insungo to reduce on the size, it doesn't necessarily mean that the size will be reduced. No, it's just let's say, I'll give an example of insungo. It will just cause like inflammation, which will be like the swelling. So once it swells, you find that the passage will be smooth. Instead of it reducing, it will reduce, yes, but it's me who's going to feel the pain whilst in the act. And in the process, you find that maybe there will be bruises and everything, and I'll have these other infections. So it's not just cervical cancer that I will predispose myself to. I'll also predispose myself maybe to HIV, maybe these other sexually transmitted diseases.
Manakare fitware paper na namba ni tura paper namba takwa ichakuti echo tutsanga ko mumuviri wesu ukuthi mbecho tunga paper na neki namba ture ukuchimikira kwa vakachana kwa inonjika ave ne vare chimikira munjira chimbi ekyo naifoeni tetwabupyako kwenya but ifwe twaiswa kuti ni business tetuleliramu bati barabike kunchavene ito parasi bambe bati yo irere tokulwala teti ntarike newe ekyo ningompo ekyo nampo.
In order to achieve the country's goal of attaining 65% screening coverage between 2019 and 2023, significant outreach screening programs should indeed continue to be enhanced.